Hi, I'm Katie, your safety trainer. Today we're diving into an important topic that touches on everyone involved in healthcare, from doctors and nurses to aides and therapists. So imagine you're in a hospital, a nursing care facility, maybe a rehab center, or even providing home healthcare services. There are times when patients need a little help adjusting their bed position or getting out of bed for other activities. Now, helping a patient with these tasks might seem straightforward, but it's crucial to get it right. Why? Because doing it wrong can actually lead to injuries, not just for the patient, but for the healthcare professionals as well. Today, we're going to explore the hazards that come with handling patients, the equipment that can make this process safer, and the best practices to ensure everyone's safety. Ready to learn how to keep both you and your patients safe? Let's get started. When we talk about manually handling patients, there's a whole range of hazards that come into play. You might not realize it, but each time you help a patient, you're actually facing risks that could really impact your health. First up, musculoskeletal injuries. These are the kind you hear about a lot. Back strains, sprains, those painful shoulder and neck injuries, and even joint or soft tissue damage. And it's not just about lifting, it's also about how often you do these tasks. Repetitive strain injuries can creep up on you, leading to conditions like tendinitis or carpal tunnel syndrome, not to mention chronic pain that can stick with you over time. But that's not all. There's also the risk of slipping or falling, especially in tricky situations like wet or slippery floors. Even when you're dealing with patients who might be uncooperative or even aggressive, let's not forget about the patients themselves. They're at risk too, particularly from falls due to uncontrolled movements. Handling these situations with care is crucial, not just for the safety of the patients, but for your own safety as well. Enjoying this safety video? There's more where that came from on GotSafety Lite. Sign up for free and gain access to our library of over 1,800 safety videos. If we don't have the lesson you're looking for, we'll make it at no cost. Click the link to sign up today. To tackle the hazards we just talked about, there's a whole arsenal of equipment designed to make patient handling safer and easier. Many healthcare settings like hospitals, nursing homes, and even private home care services have stepped up their game by using specialized patient handling and mobility equipment. Let's run through some of the key tools you might come across. There are repositioning slings and limb support slings designed to help adjust a patient's position safely. Then there are full body sling lifts. These come in various models like floor, overhead, and ceiling lifts. They are a game changer in lifting patients smoothly and safely. We also have sit-to-stand lifts, which are essential for supporting patients as they move from sitting to standing positions. And for lateral movements, like moving a patient from a bed to a stretcher, there are air-assisted and mechanical lateral transfer devices, as well as friction-reducing devices that make the whole process a lot smoother. Transfer chairs are another crucial piece of equipment, especially for moving patients around more easily within facilities. All these tools are there to protect both you and the patient by minimizing the physical strain and risk of injury. If you want to dive deeper into this, we have a dedicated lesson on patient lift and sling safety that covers everything in detail. Make sure you're familiar with all the patient handling and mobility equipment your facility provides. And remember, if you have any questions about how to use any piece of equipment, your supervisor is just the right person to help you out. Now let's talk about safe work practices when it comes to patient handling. It's crucial to understand and adhere to certain guidelines to ensure everyone's safety. The National Institute for Occupational Safety and Health, or NIOSH, has a key recommendation: keep the patient handling limit to 35 pounds. For anything heavier, it's essential to use the patient handling and mobility equipment we discussed earlier. So when you're assisting a patient with repositioning, getting in and out of bed, or other similar tasks, here's what you should keep in mind. First, it's super important to be familiar with your facility's or company's safe patient handling and mobility program. These programs are designed to minimize risks and are a must-know for anyone in a healthcare setting. Interestingly, only 9 states have mandatory requirements for these programs, but many places adopt them voluntarily because they really make a difference in workplace safety. Always make sure you've read and fully understand all the policies and procedures your facility or company have in place for handling patients safely. If anything is unclear or if you ever have any questions, your supervisor is there to help you out. Also, before you use any mechanical lifts or mobility equipment, make sure you've read the owner's or operator's manual thoroughly. It's important to know how to operate these tools correctly to avoid any mishaps. And don't forget to inspect the equipment before use. Look for any missing, modified, worn, or damaged parts according to the manufacturer's instructions and your facility's guidelines. If you find anything wrong, report it immediately and do not use the equipment until it's fixed. Safety first, always, because using compromised equipment could not only put you at risk, but also endanger the patient. Whenever possible, always opt for using patient handling and mobility equipment over manual handling. This is not just about making your job easier, it's about significantly reducing the risk of injury, both to you and to the patient. Before you even start handling a patient, it's crucial to assess their mobility capabilities. Your facility or company likely has specific procedures for this, which might include consulting a chart that details different mobility levels. This can guide you on how to proceed, especially when dealing with patients who have limited or no ability to move on their own. If possible, and after assessing their mobility status, encourage the patient to assist with their mobility and repositioning. This not only makes the process safer, but also empowers the patient. If you're unsure about how to assess mobility, your supervisor is there to guide you. If your tasks involve handling patients, consider using a team approach where feasible. Working with 2 or more people can significantly reduce the physical strain by distributing the weight more evenly. If your facility has lifting teams available, don't hesitate to call for their assistance. Always communicate clearly with your team members during the lift to ensure everyone is coordinated. Communication is key, not just with your team, but also with the patient. Keep them informed throughout the handling process to ensure they feel secure and involved. This can also make the process smoother and safer for everyone. Follow the manufacturer's instructions and your facility's policies when using any patient handling equipment. It's important that every piece of equipment is used properly to ensure safety. Take your time. Rushing through patient handling can lead to mistakes and injuries. And finally, make sure to take all your scheduled meal and rest breaks. Regular breaks are vital. They help minimize the risk of musculoskeletal injuries and keep you at your best throughout your shifts. To wrap up, when you're working in any healthcare setting, be it a hospital, nursing care facility, rehabilitation center, or even providing private home healthcare, handling patients is a part of your daily routine. This task, while essential, comes with its own set of risks, both to you and the patients. The key takeaway: always prefer to use patient handling and mobility equipment over manual techniques to minimize the risk of injury. This equipment isn't just a guideline, it's a major asset in protecting both you and your patients from harm. If you ever find yourself unsure about how to handle a particular patient or how to use a specific piece of equipment, remember, your supervisor is there to help. That's all for today's lesson. If you found this video helpful, don't forget to connect with us on social media. And remember, safety first. Stay safe out there.